Blood smells like copper and old pennies. But the ER at St. Michael's County smells like burnt coffee, institutional bleach, and the specific cheap lavender of the hand sanitizer dispensers mounted every 8 feet down the main corridor, cloying enough to make my throat tighten every single night I clocked in. I was 3 hours into a 12-hour float shift when I felt the sound. Not heard, felt. A low, rhythmic percussion working up through the soles of my shoes from the concrete subfloor. A particular weight signature, a particular cadence I hadn't experienced in 6 years and hadn't consciously missed. Not exactly. They called me the quiet night float. The limping nobody who refilled the supply cart, stayed out of the attending physician's sight lines, and kept her opinions about the clinical decisions happening around her tucked firmly behind her molars. That was how Dr. Holt described the role. That was what I had chosen. And then a man on a gurney in Trauma Bay 1 reached up and grabbed my wrist in the controlled dark of a crash scramble and said a word that no one in this building had the security clearance to know existed. Now let me tell you how we got there. My name is Marin Cole. I work nights. I float. I don't talk about the 6 years before the float nursing. And I move every 4 to 6 months before anyone gets comfortable enough to ask me why I walk with a slight drag on my left side on cold nights, or why my eyes track exits the way other people track their phones, automatically, compulsively, in the first 40 seconds of any room I enter. St. Michael's County was the 3rd hospital in 3 years. 43 beds, 2 trauma bays, a night shift attending who could actually do surgery, and 2 others who mostly signed charts and stayed visible near the nurses' station. The ER smelled like what it was: rubbing alcohol and stale sweat, and, from Bay 2, the faint sweet decay of diabetic ketoacidosis that had been sitting there since before I started my shift. The overhead fluorescents didn't buzz, they hummed. A low, abrasive frequency that burrowed behind your eyes around hour 4 and became something personal by hour 9. I had been here since March. Nobody knew my history. That was by design. I took float positions specifically because they came without expectation. Nobody assigned you a patient load and meant it. Nobody expected you to bond. You were inventory to be deployed, which suited me perfectly. Because the last time I had bonded with people in a medical setting, the setting had been a collapsed compound in Helmand Province. And the bonding had happened over a sucking chest wound and a field tube kit held together with surgical tape and whatever else was close. That was not a story I told anyone at St. Michael's County Hospital. To the night staff, the ER was organized pandemonium. To me, it was a waiting room. I'd caught 3 failing IV sites before 9 p.m., identified a tension pneumo by breath sounds alone that the second-year resident called a panic attack, and repositioned a crashing patient's airway so smoothly that the charge nurse didn't realize what I'd done until the oximetry climbed back to 97. Nobody thanked me. Nobody noticed. I was a float nurse. I barely existed. I kept my head down, my hands busy, and my left hand away from the place on my sternum where my dog tags used to rest. Old habit, old weight. Dr. Marcus Holt arrived at 10:15, 40 minutes into his shift, and announced his presence the way he always did, by walking into a room as if the room owed him a debt. He was tall, impeccably groomed even 3 hours into the night shift, the kind of doctor who wore his stethoscope like an accessory rather than a tool. His cologne cut right through the lavender sanitizer and the antiseptic, something sharp and woody that reached you before he did, which you had to acknowledge in a clinical sense even if the rest of him was insufferable. He was technically competent. I had watched him work, and I knew it. He was also exactly the kind of competent that had never once been tested by the particular conditions I had been tested in. which meant his confidence was structurally intact in about 70% of possible emergencies and catastrophically wrong in the other 30. He saw me at the medication cart and stopped. "Cole." His voice carried across the whole department. It always did. He performed it volume by habit, not by necessity. "You're on supplies tonight, not patient contact." I made that clear to the charge nurse at shift start. I had been checking the IV setup on the patient in Bay 3. The setup the overnight aide had done. The setup with the catheter at a 40-degree angle that was going to blow the vein inside the hour. "The IV line in Bay 3 is misplaced," I said. "The catheter angle. Bay 3 is under my care." He took the chart from the hook without looking at it. "Float staff handles inventory, transport, and task support. If I need a night float's clinical input, I'll request it." I haven't requested it. The ward clerk was watching from behind the desk. The aide who had done the IV was watching from the corridor. 2 residents had gone very still near the crash cart. I set down the tape. "Understood," I said. One of my knuckles had gone white on the bed rail. I released it, finger by finger, without changing my expression. It took a moment. The break room at 11 p.m. smelled like microwaved soup and the specific exhaustion of people who hadn't slept in 17 hours. I was the only one in it. I sat down with terrible coffee, used motor oil that tasted worse, and thought about Bay 3. The vein was going to blow. I knew it the way I knew certain things, through some combination of training and accumulated experience that my body had filed somewhere separate from my thinking brain. My hands knew before I did. They always had. That was not a skill you acquired in nursing school. That was a skill you acquired on a forward operating base in the dark with insufficient equipment and men who needed to not die. I had not stayed anywhere long enough in the last 6 years to follow up. That was the agreement I had made with myself. You come in. You do what is needed. You do not acquire the particular kind of caring that makes you lose sleep and makes you stay. I pressed my left palm flat against the break room table and felt the scar tissue across 3 of my knuckles. From a night outside Sangin where I hadn't had gloves and the technique hadn't cared about that. I had intubated a man in the black of a destroyed compound while mortar fire walked up the road outside, and I had kept him alive for 47 minutes until the extraction bird arrived. His name was Danny Rourke. He had made it. I had not thought about Danny Rourke in 3 years, and now I was thinking about him, and I did not know why. I stood up. I rinsed the cup. I was just a float nurse. I had chosen this specifically. You don't take this job with an ego. You take it with a shovel, and you bury the things that don't fit, and you keep moving. I went back to the floor. At 11:40 p.m., the IV line in Bay 3 blew exactly when I said it would. I was in the corridor with a transport cart when I heard the monitor change pitch, heard the patient cry out, heard the aide calling for a nurse in the specific high register of someone who has done something wrong and knows it. I was at the door before the aide finished the sentence. I had the old line capped and a new site prepped before Dr. Holt pushed through from the nurses' station. And when he came in and looked at me, at my hands, at the patient, at the fresh catheter already secured, his face did a specific thing. Not gratitude, not acknowledgement. The recalculation of a man who has just identified a threat in a place he thought was safe. "Get someone from the main team," he said to the aide, not to me. "The line failed," I said. "I've replaced it. He's stable. Who authorized you to touch this patient?" I looked at the patient, an older man, 70-ish, watching us with frightened eyes. I looked at the monitor. I looked at Holt. "Nobody," I said. "He needed it." Holt stepped closer, still performing, still carrying his voice out loud, still making sure the aide in the corner heard every word. Float staff does not perform interventions without physician authorization. If I catch you in a patient bay again without being called, I will have you removed from this hospital. There was something behind my back teeth that wanted to be said. A very specific sentence, the kind of sentence that would have ended this conversation immediately and permanently, and for reasons I was not in a position to explain to a medical licensing board. I swallowed it. It tasted like ash. "Yes, doctor," I said. I picked up the used materials and left. In the corner of the bay, the veteran in the discharge chair, the one waiting for paperwork, the one with the 1st Cavalry patch on his jacket who hadn't spoken in 2 hours, looked up at me as I walked past. He didn't say anything. He just looked. Not with pity. With something else. Recognition, maybe. The way certain people recognize certain other people. I didn't look back, and in roughly 12 minutes, something was going to change in this hospital that would make everything that had happened tonight look like a footnote. I didn't know that yet. But something in my back teeth did. The vibration started in my back molars at 12:23 a.m. Not the building, not mechanical. The specific resonance of rotary wing aircraft, heavy class, military configuration, coming in low and fast from the south. I knew this sensation the way other people know the vibration of their phones against a table. My body had cataloged it before my mind caught up. My hands went into my pockets. My back went against the supply room wall. No, not here. Not my problem. A junior resident jogged past the corridor window, checking his pager. The overhead lights in the ambulance bay flashed on. I heard the charge nurse on the radio, and her voice had the high, tight quality of someone receiving information she had not trained for. And then I heard it clearly through the walls, and I stopped pretending. Not a medevac bird. The county medevac helicopters sounded like a frantic, high-pitched whine. Civilian aircraft, civilian urgency. What I was hearing had a heavy rhythmic thud that registered in the soles of my feet and my jaw simultaneously. MH-60M, or close to it. One bird coming down in the parking lot, not the helipad, because whatever it was carrying was too urgent for the approach lanes, and whoever was flying it did not care about civilian air traffic protocols at 12:23 on a Tuesday. I pressed harder against the wall. The ambulance bay doors opened, and the gurney came through fast. 2 men in tactical gear moving with the particular economy that belongs to people who do not waste motion, not ever, not even here. And on the gurney, a 3rd figure in shredded field clothes, oxygen mask in place, saline wide open in both arms, bandaging across his chest and left shoulder in the pattern of someone who had done this in transit with whatever was available. Multiple GSWs, at least 2 to the chest. The oxygen mask was fogging in an uneven rhythm. I knew before I saw his face. Some people you recognize before you see them. The shape of a person's stillness when they are losing ground, the specific way they take up space even when they are dying. I pressed myself harder against the wall. I closed my eyes for exactly 1 second and told myself this was not my problem. That I was a float nurse. That I had made a specific and considered choice to be a float nurse. And that choice was still valid. And then I opened my eyes. And then Dr. Holt stepped into the corridor toward the gurney, 3 sentences into a directive about intake protocols. And then the lead escort. A man in task force gear I could read the patches on now. Cut Holt off with 2 words that were not loud and did not need to be. Not now. He said it the way you say it to a child. In Trauma Bay 1, the monitors screamed to life. Holt found me at the supply room door 2 minutes later. Martinez, the night security guard, was with him. wearing the specific expression of a man executing an order he knew was wrong. "I need you in the basement. Inventory count on the supply rotation." His voice was flat, final. "Now." I looked at the trauma bay. The door was partially open. I could hear the monitors, still erratic. The SpO2 alarm cycling. "The man in Bay 1 is not your patient." He nodded at Martinez. "Please escort her." I went. The basement supply room smelled like cardboard and industrial plastic and the specific chill of a room nobody used unless they had to. I stood in the center of it with a clipboard I was not going to use and listened to the sounds working through the ceiling above me. Dr. Holt had just sent the most comprehensively trained combat medic in this building to count boxes in the basement. He did not know that. He had no possible way of knowing that. But I was standing here with a clipboard, and above me a man was dying on a table in the specific way I had spent 6 years knowing how not to let happen. My hands were shaking. That was new. In 6 years of float nursing, through every situation I had encountered, my hands had not shaken. Now they were, and I understood what that meant. It meant my body had already made the decision. My mind was still catching up. I set the clipboard down. I heard the second arrival from the basement stairs. Not one bird this time. The vibration was different. Broader. Multiple sources. The layered resonance of more than one aircraft descending simultaneously. I went up the stairs before I had made the conscious decision to go. The lobby windows showed me 3 vehicles in the parking lot, doors open. And beyond the ambulance bay, through the glass, 2 more helicopters settling onto the far end of the parking structure's roof deck, running lights still active, not bothering with the helipad. Personnel moving between vehicles in tactical formation. 8 visible, possibly 12. They came through the ambulance bay entrance in a line. Not a crowd, a formation. They moved through the hallway the way a front moves through a room, organized, directional, unhurried in the way that has nothing to do with being calm, and everything to do with knowing exactly what comes next. 1 man at the point, 2 flanking, the others on coverage. Gear I recognized. Posture I had been surrounded by for 6 years. And then Dr. Holt stepped out of the nurses' station into the corridor. "This is a civilian medical facility. You cannot." The point man looked at him for the duration of 1 breath. "We'll need your trauma bay," he said. It was not a request. Holt opened his mouth again, and then something in the corridor's atmosphere changed in the specific way it changes when a room reclassifies who is in charge of it, and Holt's mouth closed. The lead man, close-cropped, task force insignia, the posture of someone who had not slept in 30 hours and could work another 30 without it mattering, scanned the corridor. He checked faces. He checked the nurses' station, the supply room door, the corridor junction. His eyes passed over me once and came back. "We're looking for a member of your staff," he said. Quiet. Not performing. Stating. "Female. Night float." The charge nurse frowned. She started to speak. He wasn't done. He said one more thing. "Wraith." 1 word. No upward inflection. He said it the way you state a fact the world already knows. Not asking if she was here, already certain she was here, just waiting for the confirmation. The word fell into the corridor like something dropped from height, like a stone into still water. The charge nurse looked around. The aide looked around. The 2 residents looked around. Holt looked around. Every person in that corridor turned instinctively, searching for whoever this word belonged to. I was the only person who didn't. I was looking at the floor, then at my own hands against the wall. The shaking had stopped. Somewhere between that word leaving his mouth and landing, Something had happened in the center of my chest that was not peace and not relief and was not anything I could have named clearly. It was the feeling of a thing held crooked for so long, you'd forgotten it was crooked. Until someone let it straighten. He found me the same way you find the thing that isn't moving in a room full of things that are. He looked directly at me. I looked back. For a moment, neither of us moved. Then I pushed off the wall. I didn't run. I walked. My left leg dragged less than usual, and I registered that distantly, the way you register peripheral information in a situation your body understands faster than your mind does. My posture changed somewhere between the wall and the first step. Not bigger, not harder. Just aligned. Like something that had been compressed under years of deliberate smallness had been given permission to stand at its actual height. He waited. When I reached him, he was quiet for a moment. Just looking at me the way someone looks at a person they were not certain they would ever find. "He's been asking for you," he said, "since they got him in the bird, before he went under." "Who authorized this run?" He almost smiled. Almost. He did, 3 times. Before and after he lost consciousness. A pause. He kept saying the name. We looked it up. That was classified. All of it was classified. My call sign, my service record, the operations, every piece of it sealed under a compartmentalization level that had no official name on any unclassified document. Which meant the man dying in Trauma Bay 1 had enough clearance to pull all of it, and had used it to find me. I already knew who it was. I had known since the gurney came through the bay. "I'm not Wraith anymore," I said. I looked at the Trauma Bay door. "But I know how to do this." I walked past Holt without looking at him. "Move," I said to the aide in front of the bay door. Not loud, not raised. The voice came from somewhere below and behind my sternum, the place where I had been keeping 6 years of compressed history. And it was not the voice I used to ask about inventory or request an IV catheter. It was the voice you use when the statement is not a question and has never been one. The aide moved. He didn't think about it first. In Trauma Bay 1, I had the situation in 5 seconds. 2 nurses, 1 resident, doing their best with the tools they had and the training they had. And their best was not enough because this was not a civilian emergency. SpO2 declining. Tracheal deviation visible from 3 feet away. The specific labored asymmetry of breath I had seen enough times to read it before I reached the bed. Danny Rourke, 6 years older. 3 apparent GSWs. 1 through and through right shoulder, 2 left chest that had shifted in transit. Tension pneumothorax, building. Cardiac tamponade possible. Chest tube kit still in its packaging on the crash cart. I looked at the resident. I looked at both nurses. I need everyone except 1 nurse back from the bed. Nobody moved immediately. The resident turned to look at me. I could feel Holt in the doorway behind me. "I'm not a float nurse," I said. The words were clean and flat and final. And it was the first time I had said them in 6 years, and they tasted exactly like they always had. "I'm the person this man flew to this hospital to find. Everybody back." They moved. I had gloves on before I reached the bed. The task force officer who had spoken my call sign stepped forward and handed them to me without being asked, the way you hand a tool to someone you have watched work before. I found the second intercostal space on the left side of Danny's chest, mid-clavicular line. Tracheal deviation confirmed right with 3 fingers, the landmark my flight surgeon had drilled into me on the ground outside Sangin. Feel it before you see it, because you won't always have the light. I felt the pressure. I felt the tension. 14-gauge needle, I said. Now. It was in my hand in 3 seconds. I positioned at the second intercostal space, superior margin of the third rib, avoiding the neurovascular bundle, and inserted at 90 degrees to the chest wall. The movement was not a thought. It was a memory that lived in my hands rather than my head, a thing etched into muscle over hundreds of repetitions in conditions that had given no room for hesitation. I inserted the needle. The rush of air was immediate. The tension released. The monitor changed. I held position and watched Danny's SpO2 begin to climb. 78, 84, 90. His color was changing. Not good yet. Moving toward good. 28 French chest tube kit, I said. It was in my hands before I finished the sentence. Behind me I could hear Holt's voice, something about authorization, about liability, about the licensing implications of an intervention performed without physician. "Someone get him out of my bay." I did not turn around. I did not raise my voice. I heard the task force officer say something brief and low, and I heard the door move, and I heard Holt's voice stop. And then Danny's hand found my left wrist, barely. The grip of a man using the last available margin. I leaned down. "I told them," he said, through the oxygen mask, barely audible. "Kept telling them you were here." "I know." I kept my hands moving. Prep the site, blunt dissection, trocar placed, tube seated, drainage system connected, listen for the appropriate bubble. "You weren't supposed to know I was here. We keep tabs." A longer breath, a pause. "Same as you kept tabs on us." I had, from the outside. Every deployment, every rotation. I had tracked the unit the same way you track a scar, checking it periodically to confirm it was still whole, still alive. The tube was in. The drainage was moving. His blood pressure began to stabilize. SpO2 at 94 and rising. I stood up straight. The task force officer had gone quiet. When I turned, he was watching the monitor. Then he looked at me. "She moved," he said quietly, to no one in particular. "The way people move when the stakes are real." Danny Rourke was out of surgery by 5:30 a.m. and stable in the ICU. At 1:15 in the morning, Commander Luis Vargas, Task Force 7, 11 of his last 14 years in the same unit Danny Rourke had served with, stood in the corridor outside Trauma Bay 1 with 4 of his personnel and addressed the assembled St. Michael's night staff. Holt was there. He had come back when security stopped blocking the door, and he was standing in the corridor with the specific stiffness of a man recalculating something he is realizing he cannot recalculate his way out of. "The woman you just watched work in that trauma bay," Vargas said, "is Petty Officer First Class Maren Cole, United States Navy, retired. She was attached to SEAL Team 3 as a Special Amphibious Reconnaissance Corpsman, one of a small number of female candidates to complete the full pipeline in her year group. She completed 4 combat deployments in Helmand Province and 1 additional operation whose details I am not authorized to discuss in this setting. She was awarded the Navy Cross and the Bronze Star with Combat 5. She holds a security clearance at a level most of the people in this hallway are not authorized to know exists." He paused. "Let it sit." The man she just kept alive personally credits her with the survival of 9 members of his unit across 2 deployments. His words, not mine. He used every minute of consciousness on that inbound bird to make sure we knew she was here. Nobody spoke. I was at the sink washing my hands. I had my back to most of the room. I did not turn around. I heard Holt's voice begin a sentence, and then I heard it stop. And then I heard nothing from it for a long time. I turned and looked at him once. Not for long. I just wanted to see it. He had no expression that covered what he had just learned. The architecture of his arrogance, the scaffolding that held his certainty up, that had kept his voice loud and his dismissals easy and his world orderly and sorted, had collapsed on itself in a way that didn't produce shame, exactly. It produced something simpler and worse. Blankness. The face of a man standing in a room he no longer has a map for. Then Vargas took one step forward. All four of his personnel came to attention simultaneously, and the sound of their tactical gear adjusting during the movement, that subtle weight shift of equipment settling into a position of respect, was the only sound in the corridor. 4 hands, 1 motion. I dried my hands on the paper towel. I turned around fully. I returned the salute. The ward clerk had her hand over her mouth. The overnight aide was frozen. The resident who had called the tension pneumo a panic attack was looking at the floor. In the discharge chair by the corridor wall, the veteran with the 1st Cavalry patch, the one who hadn't spoken in 2 hours, the one who had looked at me earlier with something I hadn't wanted to name, was crying quietly. Not hiding it, not trying to. The sun came up around 5 a.m. and nobody told it not to. Vargas shook my hand before he left at 3 and said nothing else, which was exactly the right thing to say. The hospital administrator arrived at 4 and had a conversation with Holt behind a closed office door that I was not present for and did not need to be. I had 40 minutes left in my shift when the charge nurse found me in the supply room. She stood in the doorway. She looked at me for a moment. "Cole," she said, and then she seemed to not know what followed that. "I'm restocking the IV carts," I said. "Then I'm clocking out." She nodded once. She left. I opened the top drawer of the supply cart and began arranging the IV catheters by gauge: 14, 16, 18, 20, 22. Largest to smallest, the way I had always done it, the way it made sense to do it if you thought about which ones you reached for first when something was actively going wrong. Nobody had taught me to do this. I had just done it that way from the first night of the first float shift, in the first city, in the first hospital where I had tried to be invisible. Because even when you are trying to be invisible, you still organize the drawer the way someone who needs to find things fast organizes a drawer. Old habit. I pulled the dog tags out of my pocket. I had taken them from the locker sometime in the last 3 hours without consciously deciding to. I held them in my left hand, the weight of them, the warm metal, the chain against my palm, and I looked at the name stamped into the first one. Not Cole. The other name. Still here, I thought. Still whole. I put them back in my pocket, not the locker. Closed the drawer, picked up the supply cart. There was work to do.